COVID-19 could be threatening the lives of thousands of young people who don't even have the virus. WDRB Stefan Johnson tells us about the pandemic's hidden impact on the mental health of thousands of our children.
Right. According to health experts, it is a crisis showing up in homes and hospitals across the country and right here in Kentuckiana. From saying goodbye to loved ones to frustrating pandemic shutdowns, the last 2 years have been painful for a lot of us. But health experts say it has become a state of emergency for children.
It's absolutely heartbreaking. That's the right word. And nobody's immune from it.
Dr. Brit Anderson is a pediatric emergency medicine physician at Norton Children's Hospital and shares the crisis they're seeing and treating weekly.
We've seen across the board more complaints related to mental health and self-harm.
According to the CDC, between 2019 and 2021, there has been an increase in the number of suicide attempts by teens.
In fact, now the second leading cause of death for children and young people ages 10 to 24 is suicide. So it's reached this very significant crisis state.
We're seeing kids even at the ages of 6 coming in here and just expressing a lot of anxiety.
Amy Stevens is a licensed professional clinical counselor and says the pandemic has fueled a lot of the problems for young people.
Yes, absolutely, from the pandemic, but also just with taking into account the isolation from being out of school and what that's looked like for kids right now.
Stevens shares some of the potential red flags.
Some of those red flags is just excessive energy loss, or they're either sleeping a lot or not sleeping at all. With those younger kids, temper tantrums.
Mental health professionals say in some cases, your children are taking their cues from home.
Children are aware of what's going on in their family.
It's wrong to think that this stuff doesn't impact children.
We like to think of childhood as this really happy, carefree time, and I hope that sometimes that it is for children, but I know from my experience through work that it is not always the case. In fact, it's often not the case.
If you or someone you know is dealing with anxiety or depression, the first thing I want to let you know is that there is help. To find a list of local resources, just head to our website at WDRB.com and find this story. If you have trouble finding what you're looking for, give me a call in the newsroom. I'll help navigate you to the right place.
And Stefan, you talked about some of the warning signs, but what if there are just no red flags?
Right, and that's often the case, and that's why this is an everyone problem, not just for the people at home. It's something that people should look for in school, your extended family, in the neighborhood, and people say you shouldn't be afraid to ask someone if they need help or need to talk to someone as well.
And there are a lot of red flags out there. A lot of them might be on social media. As a parent, are there some that are more alarming than others they should be looking for?
Right, Scott, some of them are very overt. Things like I'd be better off dead, or I won't be bothering you much longer, or perhaps they're giving away a prized possession or putting their affairs in order, even saying goodbye to family and friends.
All right, very, very sad topic. Stefan, thank you.
Sure.